Hey everyone, it's Simi Shaw, and welcome to Trailblazers. On this podcast, I dive deep into the journeys of trailblazing South Asians, sharing the stories of the leaders and dreamers lighting the way across the South Asian diaspora. Before we get to today's episode, a message from the Desi Crime Podcast. We've all seen and heard 1,000 renditions of the same American crime stories. O.J. Simpson, Ted Bundy, the Zodiac Killer, you name it. And if you're anything like me, you're obsessed, but overdue for something fresh, like the Desi Crime Podcast. In their episodes, hosts Aishwarya and Aryan cover the wildest of mysteries. I'm talking royal family massacres to cold cases like the death of Sree. If you're up for a South Asian spin on true crime, be sure to check out the Desi Crime Podcast on Apple, Spotify, or wherever you get your shows. Now, on to our very own episode. Joining me today is Sriekanth Chaguturu, Senior Vice President and Chief Medical Officer of CVS Caremark. As Chief Medical Officer, he ensures that patients have access to safe and affordable prescriptions while also contributing to the overall mission of CVS Health. Prior to this role, Sree served as Chief Population Health Officer at Mass General Brigham. He also spent time as a healthcare consultant at McKinsey and Company after medical school. He is a practicing internal medicine physician at Massachusetts General Hospital and a lecturer at Harvard Med School. He has published articles that have appeared in the New England Journal of Medicine, the Journal of the American Medical Association, and Health Affairs. He received his BA in biology from Brown, where he also completed his medical degree. Sree has achieved the trailblazer trifecta in healthcare as a senior business leader, a practicing physician, and an academic. And for all those reasons and many more, I am so excited to have him join me on Trailblazers today. Welcome, Sree.
Simi, thanks so much. It's really an honor to be here. I really appreciate the time and look forward to the conversation.
So it's funny because more often than not on Trailblazers, I'm talking to people that have broken out of the mold and pursued these non-traditional, out-of-the-box careers, at least within the South Asian community. But you have fulfilled every South Asian parent's dream by becoming a doctor and much more than that. How did your upbringing influence your decision to pursue medicine?
Well, Simi, I'm not a cardiologist, so I don't know if we can actually say that I fulfilled every single dream. But I really appreciate the sentiment and comment. So we as South Asians have grown up, many of us, with parents who talk about the opportunities that you can see in medicine. But ultimately, we have to make these decisions ourselves as we pursue our career. And so I am so appreciative of what my parents have provided me in terms of the opportunity to learn, educate, and make choices and make my own choices, but with their guidance and wisdom supporting me through all of that.
Absolutely.
And then as I think about medicine specifically, and as I was thinking about medicine, and I think over the course of the conversation, we can talk about specific examples, but what I love about medicine is it is this amazing confluence of different disciplines. It's a confluence of biology and science and really understanding the progression of clinical knowledge. It's then the application of that science to patients. And there's a humanism element to that. How do we take that science and make it real and bring it? And there's this concept that we talk about in medicine of bench to bedside, taking things that have been invented in the laboratory, but making it real at the bedside and taking people through their most vulnerable moments and using that asymmetry of information, the information that I've gained as a clinician, to make the life of that individual patient better in front of me. But then let's zoom out, like open the aperture, right?
Yeah.
Medicine also allows you to think about how $1 in $5 in the American economy is spent. Almost 20% of the GDP is spent on healthcare. And healthcare is then inextricably tied to every other component of the economy, whether it's the supply chain of how we produce the products that are used in healthcare, or how does it create the ability for the economy to thrive or not to thrive by creating a healthy population. So I could go on, Simi, but like to me, what I love about medicine is there's what you think of the, Marcus Welby doctor with the stethoscope going to see a patient. But then there's the public health advocates and the business and economic aspects of it too that are incredibly exciting. Like it's just an amazing confluence.
Yeah. Well, your passion definitely comes through in just the way you talk about it and all the different aspects of medicine and healthcare that you get to touch. But I am curious, it's no secret that going down this route, going down this career can be pretty grueling just because there's a number of hoops you have to jump through and the amount of time you spend. Did you ever have any doubts?
No, and maybe that's a reflection of my lack of self-reflection in those early days. But I am the kind of person that really finds joy in the things that I'm doing in the here and now. I think everything can be seen from a negative or a positive lens. And, you could talk about going through a long call night and say that long call night was the most grueling experience, or you could come at it and say, that long call night allowed me to spend time with other clinicians and be that first point of contact for patients who are coming into the hospital who are nervous and scared and are trying to figure out what is next in my path to health and recovery. And you don't go and think that every single day.
Of course.
But you kind of step back and say, like, I have the next couple of years, I'm going to just lean into this concept, this idea, and like, let me just get the most that I can. And I'm not committing to this for 4 or 5 years or for the rest of my career, but at least I can learn a lot over the next 2 to 3 years. And Simi, I would just say, like, for any of us, when we think about our careers, we should be thinking about chapters, our careers in chapters, I think. And these chapters are anywhere between 2 to 5 years. We can't learn that much in 2 years, but we learn a tremendous amount in 5 years. And if you really think about, like, I'm going to lean into this idea, this work for 2 to 5 years, get all that I can, and then I'll reassess what's next. I think, I've always thought going to undergrad, going to medical school, doing residency training are chapters. And then throughout my career, there's just been other chapters.
Absolutely. Well, I want to speak about a couple more of those chapters. You went straight through. You went to Brown for undergrad, then you went to Brown Med School. And then after becoming a physician, you embark on this new chapter where you go to work at McKinsey and Company. And, I've heard of people working in healthcare consulting before med school, but not usually after. You were simultaneously an attending at Mass Gen and also a consultant. How did that happen? And how did you balance the two?
So, Simi, it's a great question. It would seem like a left turn to go to McKinsey and Company after having finished med school and residency training. Let me talk a little bit about what that decision-making was. And it really is, again, back to this concept of chapters in a career. But it really started out when I was in med school. I had an opportunity to take a year off and go to South India. And when I was in South India, I was doing an internship through the NIH. And I was working at a clinic called YRG Cares. And YRG Cares was the largest non-governmental HIV clinic in India. And this was relatively early on in the HIV epidemic, or at least our understanding of the HIV epidemic outside the United States. And so really the fundamental questions were, could we take these concepts and ideas that we knew worked for the treatment and management of HIV in the United States and Europe and port them over to the developing world? Or do we have to adapt those protocols and figure out new medications and treatments in resource-limited settings? And so I went to South India in Chennai and working at YRG Cares for a year and a half with Dr. Suniti Solomon, who was just an incredible mentor for me, along with Dr. Ken Mayer at Brown. And what I found was when I got there, the questions that I was asking, what are the right medications to give in a resource-limited setting, were not the questions that were of interest to the patients that I was seeing. They were like, how do I get medications? How do we ensure that, like, I can just be seen as a patient and get something, some treatment? It was more fundamental questions of how does healthcare get organized and delivered. As opposed to the question of, as opposed to the question of the scientific questions that I was interested in of what medications to give. They were just like, give me the right medications, but get me medications, make sure that I can be seen. So when I went to my residency training, and I was at Mass General, I kept telling people, I'm really interested in HIV medicine, global health, and I'm really interested in these questions of health systems design and delivery of care. And my mentors at MGH were like, these are great questions, Sree. The NIH doesn't fund these questions, but you should become an infectious disease professor. And I was like, gosh, that's a non sequitur when you think about career development, that you would train in something and you couldn't actually do the things that you were really interested in.
Yeah.
And so that's when I realized like I needed to learn a new set of skills on top of what I'm learning as a clinician. So I was all in on being the best doctor that I could be in going through medical school, finishing my residency training. But I knew that to answer these questions of health system delivery, you essentially have to learn the set of concepts that you would get in an MBA or an MPH, but that's finance, strategy, operations, technology, human resources.
Yeah.
And if you kind of break it down, those concepts, finance is how do you use capital to execute upon a strategy? What strategy? How do you take an opaque question, break it down into components, and then come up with a decision on how to address the question at hand? Operations is how do you execute on that strategy in a flawless manner as best as you can? Technology, how do you use data analytics hardware to then execute on that? And the human resources is how do you compel, manage, and celebrate the individuals that are necessary to execute on that strategy with the capital that they have, the technology that they have. But look, I was not going to go take on more debt and get an MBA. And I was like, how can I start getting out there, learning and doing this work? And there's a lot of different ways that you can do that. I chose McKinsey because I was really compelled by the organization, the types of questions, and I knew I could start to build out the MBA curriculum information without necessarily having to take on the debt of an MBA. That was a choice that I made, right? Because I had done a lot of schooling throughout and I was ready to start working.
Yeah.
But I also think that there's a lot of validity of going on and getting additional degrees as well. It's just choices that people make in the career.
Super, super interesting. I mean, I'm curious, in your time at McKinsey, I mean, clearly it was influenced by the time you spent in South India and your realization that you needed to garner these additional experiences to be the best physician you could be. But while you were at the company, you eventually joined their hospital institute and became vice president of that initiative. Can you speak specifically about that role and the projects you worked on and how it contributed to that grander learning that you wanted?
Mm-hmm. As I think about my career path, I've essentially had 3 jobs post finishing my training. I've spent time at McKinsey, and then I went to Mass General Brigham, and these were in your opening comments, right, about my career trajectory. And then I went to CVS Health. But if you'll indulge me, I'll just talk about why did I make those choices, each of those choices.
Yeah, please.
And so, I spent about 4 or 5 years at McKinsey and really had an opportunity to work with a lot of great individuals there. And then as I was thinking about what's next, I was interviewing with a number of different organizations and companies, and I ended up going to Dr. Tim Ferriss at Mass General. And I talked to Tim and I said, I'm considering these things, but just wanted to get your guidance and advice, right? And I think that's a really important thing, like have a mentorship network where you can bounce these ideas off of. And what he said is, well, hey, Sree, don't take any of those jobs. I just am starting a new job and it's going to be doing something called population health management. I got to build something called an accountable care organization. And this was in 2011, 2012. None of these ideas had ever been done before. And it was a new concept. And he was like, why don't you just join me? It'll be you, me, and one other individual, and we'll kind of figure this thing out. And I was just super excited. And I was excited because I got an opportunity to work for Tim at Mass General Brigham, even though I had no idea what the content was. And then I did that for 7 years, and then an opportunity to build out our population health initiatives, accountable care. I won't go into the details of what that is, but I think it's more important just choices in career. And so after about 5 years, I ended up having an opportunity to get promoted to the Chief Population Health Officer. And when I got that promotion, I then reached out again to my mentorship network and I started to talk to Dr. Troy Brennan. And Dr. Brennan was the Chief Medical Officer for CVS Health. And so I said, can we have lunch on an occasional basis? And can I just put forth a couple of, ideas, business problems that I'm thinking through, and I just need mentorship on how to think through these things. And we did that on an occasional basis where we'd just meet for lunch and I would just talk through problems. He would help me think through that. And after 2 years, he reached out to me. He's like, we have an opening that's available at CVS Health as the Chief Medical Officer for CVS Caremark. Why don't you apply? And you'll be doing pharmacy benefits management. And I was like, I know a little bit about what that means, pharmacy benefit management. I won't go into the details again here, but I don't really understand it. But I understand CVS Health and I understand who you are, Dr. Brennan. I want to work for you at that organization. So, Simi, it was less about organizing my career around content. If you think about the choices that I made, I was like, yes, I wanted to go to McKinsey to learn some general content, but in the end, it was about working with some key individuals, Ed Stout, Bob Kocher, who were like incredible mentors to me there. And then coming to Mass General Brigham to work for Tim at Mass General Brigham, to go work for Troy at CVS Health. Never really understood what content I was going to work on, but I knew that smart people in really good organizations are going to be working on interesting things. So I've oriented my career around working for great people, great organizations, and trusting that I will learn a lot by working with them, as opposed to organizing myself around a specific question. Now, I'm solidly mid-career. I hate to admit that, but you start to hone in on some key questions that you are really interested in. And you do, as you get to mid-career to later career, have to stand up. And it's not about resume polishing. You have to believe in something, stand up for something and work for something. And so, as you accumulate these skills, being a leader is about fighting for those things. But early on in your career, I think you got to develop a set of skills. And working for great people and great organizations help you do that.
Yeah. No, I appreciate you sharing that framing. And there's two things that I found interesting. I think one, it's the idea that particularly early career, and I see this with a lot of people my age who are still, planning to apply to grad school and other roles and climbing this proverbial ladder. It's about crafting a story. And I've realized, my sister is 10 years older than me. It gets to a point where you're no longer crafting it because it is your story. It's the values you stand by. It's the stuff you want to work on to the point that you're making. And the second thing that stands out is, I think, this point on mentors and people that you've kind of shaped your career around rather than content. Can you speak to your outlook on mentorship and how you found these people to work with and what advice you'd offer in that realm?
Yeah. So to start, I'll state the obvious. Mentorship is incredibly important. But I think the way to think about mentorship is, again, in tranches. Your career is going to be early, mid, and late career. Your mentors should track to that. So if you're early on in your career, we sort of always gravitate to that top of the industry, like, somebody who's 20 years into their career ahead of us and look to them as the mentors, the senior folks that have just conquered their domain expertise. Sure. Those individuals have the incredibly big Rolodexes and just big ideas. And they're important to have. And they're important to have mentors like that in your stable of mentors. You learn so much talking to them about how they made choices throughout their career. But one of the interesting things that I've learned is that the world is very different when you think about what they were like at your age. The world was very different and the paths to advancement are different than the here and now. So if I think about my mentors when I was in my 20s, they would have said, there was no such thing as a doctor going to healthcare consulting, right? That was just an odd choice to make. And so, whereas I made that choice, right? So one thing is you want to have those senior mentors who are at top of their career, but you also want to have mentors that are about 10 years ahead of you, 5 to 10 years ahead of you, because the choices that they've made, where they're going in their career is a bit more aligned to how the world is organized and how people can make career choices given the more proximity to where you are in your career. But then the third piece, Simi, that I think is so important is the peer mentorship.
Yeah.
And that peer mentorship early on in your career becomes more and more important as you progress on, because they end up becoming the captains of industry as they move on in their career, and you end up growing together. So shortly after I finished residency, we ended up having a group of us that would meet in the Boston area that were similarly minded, interested in how do we improve the cost, quality, and experience of healthcare in America. But each of us was approaching it from a different perspective. One was from insurance, one was from startup, one was from large integrated delivery network, another was from physician network. And we would have dinners and we actually alternated at Simi, where one dinner was where we would just go around the table and each one of us would talk about the problem that we're working on and just talk about it just because it was passionate, or try to source ideas from it. Then the other dinner, Simi, we would bring our senior mentors to the dinner. One of us would bring one of our mentors, and just to talk about their own career journeys. And so it was an opportunity for our mentors, 5 to 10 years ahead or top of their career, to share with the others. And each one of us brought different mentors to the table, and it was really great. Wow. And so now I call those friends all the time because they're doing such amazing things. So again, just to summarize, Simi, I think mentorship, incredibly important. Think of it in tranches, right? Like senior, mid-career, and peer mentorship, and continue to just ask questions and foster those relationships, and they will be incredibly helpful throughout your career. There's a fourth one, okay, Simi, that I have to throw in there. You got to pay it back. And so as you progress in your career, you have to then spend time talking, mentoring, helping other people, because so many people have helped you. So don't ever forget that. And the problem with that fourth tranche is everyone mentors in a vision of themselves. So just be cognizant that your career path isn't necessarily the career path that somebody else will do, but just share your stories in an open way. Yeah. Make sure that people understand the choices that you made, so that people that you're mentoring can decide, would they make the same choice or not?
Well, that's why we have you here today, to share your story. But no, appreciate you sharing that a ton. And I feel like it's a very model way of mentorship that we should all be thinking about in terms of these 4 particular tranches. The last one, of course, being paying it forward.
Mm-hmm. Yeah.
When we come back, more from Sree on drug pricing and his most memorable experience in medicine. But first, a message from Azar PR. For brand builders, PR is power. Public relations and digital marketing agency Azar PR is here to help you harness that power and channel it into growth for your business. With a specific focus on female and minority-founded brands, agency lead Amber Sabri is your go-to if you're looking to up your public relations, media, or digital marketing game. Get in touch with them at azarpr.com and let them know Trailblazer sent you for a special offer. Now, back to our episode. I want to pivot a little bit to spend some time talking about the role you sit in today. To the point that you made earlier, CVS Caremark is the pharmacy benefits management subsidiary of the CVS umbrella company. Can you speak a little bit about what you do day to day in this role?
Sure. Well, let me first start by describing CVS Health. So CVS Health is the largest publicly traded health company in America, and an incredibly diverse company, but essentially it's 3 verticals. So you've got CVS Pharmacy. That's what you know, that retail pharmacy that's in 10,000 locations across the country. In addition to that, there's 2 other major businesses. So one is Aetna, and Aetna provides medical benefits. And so you can think of medical benefits as the coverage for your hospitalizations, your physician visits, laboratories, and imaging. So that's the ability for you to get coverage for those services. Then there's the third, which is CVS Caremark. And that's the part of the organization that I reside within. And so CVS Caremark, as a pharmacy benefits manager, is providing coverage for the last part of healthcare, which is medications. And so if we think about healthcare fundamentally, getting healthcare, right? There's a couple of things that we do as clinicians. We either observe you over time to see how your disease or health progresses. And we observe you over time over office visits, imaging, and laboratories. Or we intervene at a point when you are sick. And we intervene in two ways. We either operate on you to take that thing out or to figure out what's going on, or we give you medications to alter the trajectory of your disease. And guess what's the most frequent of all of those things?
Medication.
Medication is the most frequent interaction that we have in healthcare. So the PBM, there's essentially in America 3 major pharmacy benefit managers, us and Cigna and Optum. So CVS Caremark covers 100 million lives. Wow. So 1 in 3, essentially 1 in 3 Americans receive their drug coverage through CVS Caremark. And what we do is ensure that you have, starting with clinical integrity, we determine what are the medications that will be covered and then provide systems for that coverage. This can become a pretty technical field in terms of how the drug coverage benefit is administered. But your question was, what's a week in the life? But if you think about this concept of drug coverage, one piece of this is the medical review. So we have just looking at the pipeline of medications, ensuring that we have an understanding of that pipeline and providing a clinical perspective on what's the role of those medications in therapy. And then there's the development of formularies. So how do you then provide that coverage? And once that coverage is provided, we have pharmacists and physicians that are providing reviews of the request for those medications and ensuring appropriate access and coverage to those medications. So there's a lot of internal pieces, Simi. So you can imagine there's day-to-day at the internal. Then there's the external, and the external is for ensuring that our new clients, and those clients can be the government, it can be other health insurance companies, or it can be employers. And if you think about 100 million lives, it is all 3 of those, and it's small employers to large employers across America. You're talking to them both either as prospective clients to help them understand why CVS Caremark and how can we ensure that their members, their employees and beneficiaries, their population will get the best service to the most frequent interaction in healthcare. Or part of it is working with and ensuring in physician communities. And this is sort of the public facing, not on a client facing, but a public facing is ensuring that the government or stakeholders like patient advocacy groups or physician groups understand what we're doing. And so there is a bit which is explaining our work. And so, Simi, I think the only thing that's constant is variation. Every single day is different. It's a complex set of problems, but I find it incredibly compelling because we're really thinking about how do we ensure drug affordability and drug accessibility and the cost and access to the most frequent interaction in healthcare.
Yeah, super, super interesting. I'm curious, you became Chief Medical Officer in September 2019, just months before the pandemic hit. In what ways did the context and premise of your role expand or change with the pandemic?
It was incredibly head spinning. September 2019, and I remember my boss, Dr. Troy Brennan, asking me to put together an assessment for the company in December and January of 19 and 20 of this novel coronavirus that had been identified in China and what would be the impact for the company. And, it was very hard to make that assessment. What would actually happen? And shortly thereafter, we all know the story of how the economy shut down and the virus started to spread throughout the country and throughout the globe. And CVS Health overall, I am incredibly proud of the work that we've done as a company in our response to the novel coronavirus. it started out with how do we ensure continuity of care during those early days? And so if we think about medications, there was incredible pressure on how were medications coming into our country and how do we ensure that there was continued supply of medications to this country and that there wasn't disruption. And so a lot of our early work was ensuring the drug supply chain and availability, both from a coverage perspective, but also from throughout our retail pharmacies.
Interesting.
Then the next piece was testing. In those early days was quite difficult to extend, but we had the opportunity to use our locations, our nearly 10,000 locations within close proximity to 90% of America within 5 miles, that we had the opportunity to then be the first line of testing in many, many communities across country. So we had to rapidly determine how do we actually do community-based testing, retail-based testing, and we have now done tens of millions of coronavirus testing throughout the country. Then we realized we could extend that testing to universities and businesses around the country. So we built, and I had the opportunity to lead what we called Return Ready, which was to provide that testing to companies and universities across the country and to help bring the economy back after that initial shutdown. And then the story around vaccines started to unfold. And so my team had an opportunity to work very closely with the US government, as well as with the pharmaceutical manufacturers to understand how do we bring these vaccines out to the country. And so our team initially started with nursing homes and then extended it throughout the country. And I think you all know the story of how we've been able to provide vaccinations, the most vaccinations in the country throughout our pharmacies. So I can't tell you how proud I'll look back at my career and just be humbled by the opportunity to work in this organization with this incredible team to do our part to the pandemic. The whole nation was working hard at this, but I'm incredibly proud of what we did at CVS Health.
Yeah. No, it sounds pretty incredible. And it also just speaks to the immense reach that CVS Health has within this realm. To that end, I'm curious, 2 years before you took on this role in 2017, the largest healthcare merger in U.S. history took place, the CVS-Aetna merger. And, initially, many states, including the DOJ, expressed concerns that the merger would create antitrust concerns, provide fewer options for customers, contributing to the trend of rising drug prices, which we still see today with the price of certain drugs like insulin. As someone who's focused on the prescription pharma space within this large CVS business, what are your views on this merger and the broader trend of consolidation in the space?
What's important that across all of healthcare is that individuals have choices, companies and governments have choices in the private sector to determine what model it works best for the goals that they have for their population or that individuals have for themselves. And what we see as an opportunity at CVS Health is to demonstrate that with integration of medical benefits, pharmacy benefits, and locations throughout the country, that you have a more seamless experience as a consumer of healthcare to get the coverage and services that you need to manage your health. And so that is what we're so excited about in bringing together Aetna, CVS Caremark, and CVS Pharmacy. And what we announced actually in December of 2021 in our Investor Day is where we are going to be extending into primary care as well.
Yep.
And so we at CVS Health have been providing care delivery, which is the actual provision of medical services for decades. And probably the care delivery that most people listening to the podcast know is MinuteClinic.
Yep.
Our clinics in our retail pharmacies. But as we extend forward, MinuteClinic over the last 10 years has transformed from providing just acute care services to preventative services and now chronic disease management services, such as weight loss, smoking cessation, managing your diabetes. And so you can think of that as primary care services. So MinuteClinic has transformed into acute care services and primary care services. And we are now through, as we talked about in December, we'll be making acquisitions into primary care to then provide chronic disease management, care management, behavioral health support across the country. So we're really excited about being able to offer health coverage, pharmacy services, and care delivery as we evolve as CVS Health. And so, again, consumers have choices, patients have choices, employers have choices. We think that CVS Health offers us something very unique in the marketplace that can answer many of the questions that people have around how to best access healthcare.
Yeah. What do you see for the future of healthcare, just given the competing demands of patient outcomes versus business outcomes? We obviously see it with the trend of mergers like these. And in the case of CVS and Aetna, that was obviously a strategic acquisition, but there's obviously more financial oriented decisions like by big private equity firms. What are your thoughts as someone who's a practicing physician?
So, healthcare's challenges will continue to be around cost, quality, access, experience. Those are four major issues that we contend with. And so that's been called a quadruple aim, but just this notion that we have these competing interests, and ideally we are advancing all four simultaneously. But unfortunately, the history of healthcare is that we start to work on one and the other part of the balloon starts to expand or contract. And so those are the challenges.
Yep.
But cost, quality, access, experience will continue to be issues. We see on costs, we continue to see ever increasing costs in healthcare.
Yep.
Part of this would be expected. Simi, if you'll indulge me from like an academic perspective, there's something called Baumol's cost disease. So Baumol was an economist that talked about that labor-intensive sectors of the industry will always take up a greater percentage of the GDP compared to non-labor-intensive sectors. And so why is that? Labor is the major component expense in a sector, and wage growth. If you don't have automation in that industry, the wage growth ends up becoming a bigger and bigger part of the GDP. So the two parts of the economy that have grown higher than the rate of GDP expansion have been healthcare, obviously, and education, two labor-intensive parts of the economy. That means that automation, technology will continue to be major issues that healthcare will need to contend with. How do we use technology? And, we can get fancy talking about artificial intelligence, machine learning, and the metaverse and whatnot.
Yep.
That's probably for another podcast. But the cost increases will continue to be a major issue. The integration of technology will be a major issue as well. And ideally, it's to counteract what we would call Baumol's cost disease. But if you look at the last 100 years of healthcare, the major step changes in costs in healthcare actually have been technology driven. The advent of the X-ray, the advent of CABG meaning coronary artery bypass grafts, or radiation oncology, or new medications. So interestingly, even though technology in other sectors reduces costs, in healthcare it tends to increase costs. That's the cost problem. On the experience problem, we continue to see that we have not oriented healthcare to be consumer friendly. It's completely fragmented.
Yeah.
And you have to think about how many logins and passwords you have to manage your healthcare experiences, let alone when you actually get in to see a provider, it's after you've gone through many, many hoops to get in to see that individual. So, I think another challenge is going to be, how do we make healthcare more consumer friendly so that it feels more like a consumer experience? So that'll be another challenge. And then on the quality side, we're just scratching the surface of measurement in healthcare. We've only really started measuring healthcare and healthcare quality over the last 30 to 40 years. And we only have a very small subset of quality measures. And so we have nearly 10,000 human conditions, but we spend an inordinate amount of time measuring quality in about a dozen or so conditions.
That sounds about right.
Yes, those dozen or so conditions really are the majority of our expenses, but that doesn't mean that we shouldn't be caring about measuring quality across the entire system. We could talk about very specific issues, but in the end, it's costs and the integration of technology, quality and how we're going to expand quality measurement, experience and how do we make it more consumer friendly. I mean, these are going to be the major challenges of healthcare for the next, quite frankly, decades that we'll need to work on.
Yeah. Well, some innovation that we've seen on the cost front recently came from Mark Cuban with the launch of his Cost Plus drug company, which is aiming to disrupt the pharma industry by tackling the drug supply chain, cutting out the middleman, and ideally reducing costs for consumers. What are your thoughts on innovation and initiatives like his?
So we continue to see a lot of innovation in the pharmacy benefit management space. I think it's important to continuously think about new and innovative ways to reduce drug costs. The Mark Cuban effort is interesting and welcomed as a new way to identify, essentially it's identifying low cost versions of high cost generic drugs
Yeah.
and providing transparency on the pricing of those drugs. So I think that is an interesting part of healthcare. It's a small part of healthcare. At CVS Health, we're focused first and foremost on helping clients control drug costs and using scale to find competitive costs for generic products. But in addition to generic products, when we look at what's driving healthcare costs, it's in something called specialty drug costs. And those have been the primary driver of year over year cost increases.
Yeah.
Specialty drugs are complex medications, generally biologic medications compared to small molecule chemical compounded medications. And these small subset of patients drive over 50% of the drug cost. So I think working on generics is important, creating transparency there is important, but I think the major focus that we need to have in addition to managing generic medications is on specialty medications. I also worry, Simi, about carving things up and having an uncoordinated experience. It gets back to the comments I was saying as a consumer. If
Yeah.
you start to manage one part of pharmacy here, but don't manage the other part of pharmacy, patients generally who are taking medications are taking more than one medication. And so it's important to make sure that that experience is seamless to individuals. You don't want the experience to be different because you're taking, let's say, a statin for your high blood pressure, but you're also taking a biologic for your rheumatoid arthritis. You're going to two different places and the experience is different.
Yeah.
I think it's just very challenging.
Yeah. That certainly speaks to the case for, a centralized system that provides end-to-end care, which obviously a lot of people in the space are talking about today.
It's important to have interoperability as well, right? Like we recognize
Yep.
that there's going to be different people who are going to be really good at different parts of healthcare. And we want to have interoperability and connectivity between those different parts of the healthcare system. And you want expertise in those different domain areas as well.
Absolutely. And I feel like interoperability is a huge part of the conversation when it comes to health tech and new like EMR technology and things like that, just from a basic level. Clearly, you being a physician in real time has informed the way that you approach your role as a business leader in the space. Can you speak a little bit to how that's worked and how that's functioned, and what ways your role as a physician informs your work as a business leader and vice versa?
It's a great question about what's the interplay between clinical medicine and organizational advancement. I think that one of the things that you learn as a clinician, there's something called the history and physical. When you meet a patient, you sit down and try to understand why are they there in front of you and what help are they seeking and how can you actually help them. And so you start to ask them a series of systematic questions and try to understand from head to toe. Ask first, then examine, then you make an assessment and plan. If you think about business problems, it's the same thing. You got to
Yeah.
ask questions, examine, then make a determination about what's your assessment and what's your plan for executing on it. So I actually think the skill set of a clinician extends really well into thinking about business problems. I'm going to say something that's not exactly right. I'm being simplistic.
Okay.
But as a physician, we're trying to make the most correct answer because we want to make sure that the patient gets the best solution. You don't want the second best for your patient. You want to always provide the best that you can. A lot of caveats to that, but let's just
Sure.
go with that. And in business, you're trying to make the best solution, but you're also trying to make the least worst solution, right? So there is a danger of clinical thinking applied in the business where you start to overanalyze and overthink through things. So I find like in the business world, it's important to make sure that perfection should not be the enemy of good enough, and you can start to course correct. But you can't say that in clinical medicine. So there is a different way of thinking.
Yeah.
And you can't apply that thinking in clinical medicine. The other piece of being a physician executive is to be able to be the voice of the patient, to be the voice of the clinician, and to represent the physician and the patient in the discussion around the imperatives of the organization. And so it's incredibly important to have a moral compass and to do right by patients and clinicians so that organizations that are working in healthcare or have a healthcare objective understand those two perspectives. And those that sometimes will be orthogonal to the business imperatives, but you have to stand up for those two constituencies. And most importantly, the patient.
Yeah.
Because we have to organize around the patient. And that can lead to some very difficult conversations within an organization, but those are important conversations to have.
Yeah. Well, I feel like, again, I'm saying this, but it's the case for people that are multi-hyphenates in that way, that have that sort of cross-pollination of skills that can speak to the patient experience while also understanding the business objectives, as you said. Super, super interesting. Thank you for sharing that. I'm curious, you've seen three sides of healthcare. You've seen the management business aspect, you're a practicing physician, and you're also an academic and teacher. Which is your favorite?
All three.
No, you have to pick a kid.
I think they do really feed into each other. Yeah, no, I would never pick a kid, but I think each one plays a role. So I think being an executive allows you to think, on systems levels questions. Being a clinician allows you to actually be in the trenches and see how all of this works and never to forget the patient, never to forget the clinician. And then being an educator or mentor allows you to take time to process and to think and to reflect back out to the world what you've experienced in those other two areas. Simi, for me, joy comes from doing all three and leading a life that allows me to learn from all of those different components. So sorry, not picking a child.
What's been your most memorable experience thus far?
Oh, gosh, that is a really tough question. But I would say it's back where we started, Simi, in those early days in India doing HIV care and recognizing this confluence. It wasn't one specific moment, but that was an incredibly formative year for me in recognizing the interplay and like the specific role a physician and a physician who's thinking about systems questions could have some sort of impact. And, it's really been an organizing thesis around my career. So that really has been the formative experience for me.
Yeah. No, it sounds like it. Can you share some parting advice for the aspiring pre-meds and doctors that are out there that might look to your careers to get a sense of how they might chart theirs?
A lot of physicians ask me about this path in being a physician executive. And I tell them you still have to be the best doctor that you can be. Really, have to learn clinical medicine and continue to do that work and doing right by patients every single day. And then if you do move into the executive role, even if you're taking a heavy business role and you're not the chief medical officer, but you're the chief operating officer, the chief executive officer, you still have that MD behind your name and to make sure that you orient the organization around patients and clinicians. I would say one of my mentors, Dr. Alan Lotvin, who is the head of CVS Caremark, he runs our pharmacy benefit manager, but he's an interventional cardiologist. And he will always talk about like consumer experience, the patient experience, despite being the chief executive running the company. And I think that's incredibly powerful and organizes the company in a very different way than if we didn't have those conversations.
Absolutely. Well, thank you so much for sharing that. And thank you so much for taking the time to share your story with so much thought and insight. I appreciate it a ton and really excited to share it with the world.
Simi, thank you so much for what you're doing and giving all of us an opportunity to share our stories. So thank you so much.
Thanks for joining us for today's episode. If you want to get new episodes straight to your inbox, subscribe to our newsletter at southasiantrailblazers.com and follow us at South Asian Trailblazers on Instagram, Facebook, and LinkedIn.